today's video, I'm going to talk about the anatomy and physiology. So we are going to do the anatomy of the nose in a systematic manner. We are going to cover the external part of the nose and the internal part of the nose. So the external part of the nose, the composition is osteocartilaginous, meaning that this is the bone and this is the cartilage. You can just touch your nose and feel the texture of the bone, and you see, is this bone or is this cartilage? So the bones that we have two bones, that is the the nasal bone and the frontal process of the maxilla. So this is the frontal process of the maxilla, and then this is the nasal bone. In the cartilaginous part, we have three parts of the cartilage. We have the upper lateral cartilage, we have the lower lateral cartilage, and we have the septal cartilage, which kind of forms the part of the both the internal and the external nose. So in addition to that, we have the skin covering the nose. So the skin covering the nose has multiple sebaceous glands, and when these glands usually swell, they usually form a potato shaped nose. So the internal part of the nose, which also commonly known as the nasal cavity, it extends from the nostrils, that is the anterior nasal, to the conchi, and opens into the nasal cavity. So we are going to deal first with the nasal septum, which divides the nasal cavity into the left and right halves, and it is composed of a bony part and a cartilage part. And the bony part is the septal cartilage, which I've talked about, and the bony part is the perpendicular plate of the ethmoid and the vomer bone. So we have the perpendicular plate of the ethmoid, that's the superior part, as we have seen here, and then we have the vomer part, that is the posterior infralateral part, and then we have the septal cartilage, which is the anterior part. In addition to that, in the nasal cavity, we have in the nasal cavity, or in association to the nasal cavity, we have the paranasal sinuses. So in the paranasal sinuses, we have these are hair-filled spaces which are connected to the nasal cavity. Literally, they are not in the nasal cavity, but they are connected into the nasal cavity. So we are going to see how they are connected. So, however, before we see how they are connected, you can see how many sinuses we have. We have the frontal sinuses, which are observed here, which are above the eyes. We have the maxillary sinuses, which are the largest and within the maxillary. We have the ethmoid sinuses, which are between the eyes. So the frontal, the maxillary, the maxillary sinuses and the sphenoid sinuses, these are paired sinuses, whereas the ethmoidal sinuses, these are just multiple and are in the lateral wall of the nose, that is in the nasal cavity. We have three turbinates, and if we have the inferior turbinate, we have the middle turbinate, and there we have superior turbinate. So below the turbinates, we have the openings that are called meatas, and these openings, there are just three of them, just as the turbinate. So we have the inferior meatas, which serves as an opening to the lacrimal duct. We have the middle meatas, which serves as an opening to the major sinuses, except the posterior ethmoid sinus, that is the frontal, anterior ethmoid and maxillary sinus. And then we have the superior meatas, which serves as an opening to the posterior ethmoid sinuses. In addition to that, we also have sphenoethmoidal recess, which serves as a opening to the sphenoid sinus. So just as a repetition about the sinuses, we have the paired ones that include the frontal sinuses, the maxillary sinuses, and the sphenoid sinuses, whereas the unpaired one, we have the ethmoid sinuses, which are unpaired but multiple. So the innervation to the nose, where we have both sensory, and in sensory we have the somatic sensory and we have the spatial sensory, which is spatial is supplied by the olfactory nerve, and the somatic sensory is supplied by the trigeminal, which supplies the face. And we have autonomic, that is parasympathetics and sympathetics, and this is all done by different cranial nerves. So the sensory innervation, we have the spatial sensory, that is the smell, which is offered by olfactory and nerve, that is cranial nerve number 1, which provides sense of smell. We have the olfactory epithelium in the upper nasal cavity. Then we have general sensory, that is touch, pain, temperature, and this one is supplied through the trigeminal nerve, and which is divided into according to the portion of the nasal cavity, that in the upper part is supplied by the V1, that is all ophthalmic nerve, and the lower part is supplied by the maxillary nerve. So the ophthalmic nerve, that is V1, supplies the anterior and the upper part of the nose, and the nerve behind that is a branch of nasociliary nerve, which is the anterior ethmoid nerve. Whereas the lower part or the lower and the posterior part is supplied by the maxillary nerve, that is V2, and the branches include nasopalatine nerve, greater palatine nerve, and lesser palatine nerve. Whereas the autonomic innervation, where we have the parasympathetic and the sympathetics, and these ones are involved in glandular secretions. And for the parasympathetic, which is secretomotor, which stimulates the mucosal glands to produce this secretants. So where we have the facial nerve via the tigropalatine ganglion. So it gives so it stimulates the mucus secretion in the nasal cavity, as I said before, and then it follows. So the nerve that is given off from the facial nerve is greater petrosal nerve, which which moves to the pterygopalatine nerves, and then it is given off by the branches of V2 to reach the nose. The sympathetic, that is the vasoconstriction of those mucosal gland, it's given through the superior ganglion and via the deep petrosal. And this controls the blood vessel constriction in the nasal mucosa. So this joins, that is the deep petrosal nerve, usually joins the greater petrosal nerve, which we have seen provides the parasympathetics, to form the nerve to the pterygoid canal or the median nerve just before reaching the pterygoid palatine. And then in the pterygoid palatine, these parasympathetics and sympathetics are going to be given off there, whereby they're going to reach the nose. So the blood supply to the nose is supplied by both the external carotid and the internal carotid. So let's begin. You have to know, if this is a must for you to know the blood supply to the nose, and this is because of epistaxis. So we have, let's begin in the upper part. We have anterior ethmoid artery. So if we have anterior ethmoid artery, then we are going to have a posterior ethmoid artery. And around this region, this is where it's called the sphenopalatine, and therefore we're going to have a sphenopalatine artery. So in the lower part, we have a greater palatine artery which comes in and forms. So in the lower part, we have a greater palatine artery. In addition to that, we also have a superior labial artery which comes from the facial artery. So here we already have a plexus here, and this plexus is called the caecile plexus. And this plexus, if it is injured, we can have epistaxis. So the branches from the anterior carotid artery circulations, these are the anterior ethmoid and the posterior ethmoid, whereas the branches from the external carotid include the sphenopalatine artery, then we have the greater palatine artery, and then we have the superior labial artery, which comes from the facial artery. So the clinical pulse for the blood supply to the nose is the commonest area of anterior epistaxis is the caecile plexus. So I have a question for you. Among this artery, that is a posterior ethmoid artery, posterior and anterior ethmoid artery, sphenopalatine artery, greater palatine artery, the superior labial artery, which does not form the caecile bell plexus. So just zoom at the image and tell me which does not form in the comment section below. So the function of the nose, we have humidification, we have temperature control of inspired air, and then this is because it is involved in the respiration. So the nose is part of the upper respiratory system. In addition to that, it's also involved in the filtration of the allergens and dust particles. In addition to that, it's also involved in the vocal resonance and olfactory